So Kathy, I want to bring you back in because as an administrator for a cancer center, you're probably actively involved in contracting and likely working directly with the group purchasing organization. And so you're having to deal with the issue of your contract and the potential for rebates because you're running a business. And so you got the social responsibility and the practice responsibility and the business responsibility, and it can weigh heavy as you make those decisions. And you may in your heart of hearts believe that we should bring down the total cost of care, but as a practice, we have to also run a business and be viable as a business. And that contract for that reference brand is really attractive. And so we may have to do that. All right, so tell me more about that. To what extent, you don't have to be specific, so we don't have to name names, but that is a reality in the same way it's a reality on the payer side, which Karina can address. It's a reality of the practice side because we're mixing this business, with the science and the medicine.
Mm-hmm. So I'd like to back up for a second, though, and kind of piggyback to what Dr. Diaz was saying earlier. For biosimilars to be successful in community oncology, which is my world, you do have to have that physician champion within the organization, but you also have to have that administrative champion. And then you have to have the marriage of the two, because the physician has to tell me, it's efficacious to be able to give this. And then it's my job to figure out how we're going to handle that. And then you take those products. And what I generally do is I look at my last year's worth of patient data. I figure out who's on what. Then I take all of those, the biosimilars, put them all together into a spreadsheet and look at my rebates. And then I also have to, and I come up with my delta on the end. But then I also have to look at my payer issues. And so we're not going to name names, but to what Bhavesh brought up earlier, rebates and those rebate walls that we have can be a problem and can tie our hands to make those successful within a practice. So if I'm required by a payer to use an originator, and I have a large percentage of my patients are on that particular health plan, then we have a problem on our hands. So then that changes the way my formula works.
Right, so now you've got to think about your contract and what threshold can you hit? Yeah. And you have to go all in for the originator, even though you might have wanted to really pursue the biosimilar, because at least for this current year, until you can get FaceTime with the payer and talk this out, and make the case for both, or that the biosimilar is willing to match that rebate with the payer. You're kind of stuck having to make the decision.
So it's a couple of things. It's contract design, whether I'm having to hit a market share or, and what that market share looks like. Most of the market shares for the biosims sit kind of low. So because they do want adoption of the product, but also we're having issues of GPO parity. We've seen some biosimilars have brought out some very interesting market forces that a lot of us haven't seen before. So perhaps an originator manufacturer making a parity deal with the GPO, That happened last year when the biosims started coming out. So if you were aligned with a particular GPO, you had access to one biosim, and that was the way it looked. Right. That was fascinating because we've never really seen that kind of parity hit. And it was not the one that we chose to use. So then that becomes an issue. And it's really presented some interesting problems, some challenges. And then if you have multiple payers that all require something different, you do have to evaluate your processes. And you have to maybe accept that you're gonna have to split your basket several different ways. But then I find it better to have those contract conversations with the biosimilar manufacturers. Because at the end of the day, they need their products to be successful. They understand the economics and the market forces that we're facing. And you've seen a lot of movement and a lot of flexibility in contract design from those biosimilar manufacturers.